Good morning, my name is Celine and I'll be your doctor for the day. May I ask what is your name? Okay, so Miss Jessica, today we're here to do a closing of your wound because is it true that you had just a bicycle accident last Monday, which is 2 days ago? Yes, okay, so can I know the onset and how it happened and how your wound is? Okay, thank you for the information. Now I will examine the wound. So can I please take a look? I will take a look at the location, the extent of your wound, and the type, whether it's like a torn, cut, abrasion, fracture, which is only your skin is torn, and I don't see any signs of infection. Next, I will explain the purpose of today's procedure is to close your wound. So I will apply basic surgical skills, which is hecting to close your torn skin. And in this procedure, I will inject you with anesthesia and I will suture you. Are you okay with that? Okay, thank you. So I will prepare the necessary tools and material, which is the closed stainless steel container, the triangular needle, the needle holder, the anatomical tweezers, the surgical tweezers, artery clamp, tissue scissors, 3cc syringe, thread scissors, 2% lidocaine, plain cut thread, and site number 3, sterile gauze container, povidone iodine, container, and 3% dehydrophysiological NaCl, sterile surgical cover, and sterile gloves. So could you please prepare yourself? Please stay calm and position yourself like this. Okay, so I will prepare the anesthesia, which is the lidocaine. Okay. So I prepared the anesthesia and I will wash my hands now. Okay, next I will wear sterile gloves. Okay, next I will perform aseptic and antiseptic techniques, which is the alcohol swab. I will swab it from inner to outer in a circular motion. And then I will use another alcohol swab and swipe it in a vertical way following the wound. Okay, so next after that I will perform local anesthesia. I will use the infiltration method. So excuse me. Now to the other side. Okay, so let it set in. And I will dispose the needle in the waste bin. And after that, I will perform debridement using the perhydro, NaCl irrigation, and Providence. So I will use the gauze, the sterile gauze, and dip it in here. And I will perform debridement. Okay, so we're done with that. And next I will apply the sterile surgical cover. Okay, and I will explore the wound to stop any bleeding. So next we'll be doing a simple continuous suture. So this one, same as before. I will prepare the needle and hold it in the distal 1/3. Then I will lock it. And then for this simple continuous suture, I will start placing a knot 1 cm above the top of the wound, which is tight but not cut. And then I will do a series of simple suture placed into session without tying or cutting the suture material after passing through one knot. And the suture spacing and tension must be even throughout all the suture along the suture line. And after finishing at the end of the wound, I will tie the last knot at the suture line. And the knot is tied between the tail ends of the thread coming out of the wound of the last suture. So I will begin now. Okay, so I will insert the wound in a 90-degree angle. Okay, so I will tie the first knot. And after this, I will continue suturing. I'll start suturing now. So I will continue at the other side and make sure that the suture is even. Okay. And I will continue again, placing the needle holder at the distal 1/3. Okay, so I will continue without stopping. Make sure that the spacing between the sutures are even. Okay, so I'm going to close the suture now. I will tie a double knot and tie the suture over here. Okay, now I will cut the excess suture. Okay, so we're done with the simple continuous suture. Today we'll be doing the simple interrupted suture. So the wound here has been prepped before and all the surgical instruments are already prepared as well. So today we'll be using the chromic catgut suture, the 3 metric one. Okay, so the needle, I will insert it to the skin. So here's the needle. I'll hold it in the distal 1/3 using the needle holder. And I will lock it now. Okay, so it has been locked. And I will insert the needle into the skin on the first side at an angle of approximately 90 degrees. It will enter the subcutaneous tissue and it will pass through the middle of the wound. And I will insert it further through the subcutaneous tissue so that it will penetrate the other side. And it should be noted that the size of the skin and the subcutaneous tissue sutured on both sides of the wound must be the same for both edges of the wound to approach the right position in the position opening outwards. Okay, so I will start now. Okay. Okay, so next I will tie a knot. Tie it once more so that it is secure. Okay, so I will cut it now and move on to the other one. So the same thing, I will hold the needle in the distal 1/3 with my needle holder. Okay, and since it's already in position, I will lock the needle now. And I will continue my simple interrupted suture. Next, I will tie a double knot like before and tie the suture. To ensure extra safety so that the needle will hold, I will tie another knot. Okay, so we're done with the simple interrupted suture and I will cut the extra suture. Okay, so that is all for the simple interrupted suture. Thank you. Okay, good morning. Today we'll be doing the vertical mattress suture. So the wound has been prepped and we'll begin with the procedure now. Okay, so for this type of suturing, the needle will be inserted into the far edge of the skin on the first side of the wound, and it will cross the wound and skin on the other side, then out into the far edge of the skin on the second side here. And then the needle is then gently inserted back in the front edge of the skin on the second side, and it will cross the wound and roll back out in the near edge of the skin on the first side. So I'll begin now. Okay, so I will be inserting the needle now. Okay, next I will take the needle again. And I will insert it to the front of the skin, so when it will come out. Next I will be pulling out the needle. Okay, so and I will be tying the needle next. Okay, so that is it for the vertical mattress suture, and I'll be cutting the excess suture tie. Morning. So today I'll be doing the subcuticular cutaneous suture. So the wound has been prepped. So in this technique, first I'll insert the needle into the skin approximately 1 to 2 cm from the end of the wound, outward into the dermis area of the skin on one edge of the wound. And then it will be passed through the dermis tissue of the other side alternately and continuously until it reaches the other end of the wound. And then the suture or the thread will exit 1 or 2 cm from the other end of the wound. So therefore the thread will run along the skin on both sides parallel along the wound. Okay, I will start. Because one is torn, so therefore I will do it again. Okay, it's torn.
is how to do the suturing type, and it will continue until the end. Thank you.
Okay, so next is for the surgical wound care. So I will clean the wound with the povidone gauze. So this is the gauze which I will dip in the povidone iodine. Okay, and I will cover the wound with a povidone gauze and a sterile gauze. So I'll dip another gauze in povidone iodine and I will cover the wound. Okay, so next I will clean all the tools and the materials and put it in a waste container. And I will remove my gloves and conduct 6 steps hand washing. And I will record your record into your medical record, such as the location of your wound, the type of your wound, the type of action like the number of sutures I used, and the type of suture, which is the CapCut 3.0, and also educate you. So you should take care of your wound, avoid getting water or getting it wet when you take a bath, and also you have to apply the medication, the topical medication I give you, according to the regimen. And I will schedule you for another control in 2 weeks while removing your sutures. And also please avoid any touching in that area. Okay, that is all. Is there any questions you need to ask me? Thank you.